Parker et al. Aim: to compare the extent to which depressed Chinese patients and Malaysian and Caucasian patients in Australia identify both cognitive aspects of depression and a range of somatic symptoms as a sign of their depression, and the reason that they sought professional help. Method: 50 Malaysian and 50 Australian participants of Caucasian Western descent were part of the sample. The Australians all had English as their first language. All participants were outpatients who had been diagnosed with MDD but did not have any other diagnoses. The Chinese participants were a mix of Chinese and English. 80% of the patients spoke Chinese as their first language, while 20% spoke English as their first language. The questionnaire was based on two sets of symptoms. The first set was mood and cognitive items that were common in Western diagnostic tools for identifying depression, such as the DSM-4. The second was part of a set of somatic symptoms that were commonly observed by Singaporean psychiatrists. The questionnaire was provided translated in both Malay and Mandarin Chinese, cross-translated for credibility. Patients were asked to judge the extent they had experienced each of the 39 symptoms in the last week. They only had 4 options on the scale of rating: all, most, some, or not at all, and they were all asked to rank their symptoms in order of how distressing they were. The primary symptoms that led them to seek help was also recorded. Results: 60% of Chinese cases identified a somatic symptom, compared to 13% of the Australian sample. There was no significant difference between the numbers of somatic symptoms linked to their depression. However, Chinese participants were significantly less likely to identify a cognitive or emotional symptom as part of their problem. They were less likely to rate hopelessness, helplessness, depressed mood, poor concentration, etc., compared to the Australian participants at the top. Conclusion: the role of culture is evident. In Western culture, it is more appropriate to discuss one's emotions, and depression is seen as linked to a lack of emotional well-being or poor mental health. Whereas in Chinese culture, it is less appropriate, even stigmatized, if one speaks about a lack of emotional well-being.